View of all these arteries we talked about this morning. In Cavenous Sinus, it's a unique structure, surrounded by this bones and thick duras. There is a periosteal dura and meningeal dura, okay? And the two layers, they're separated in between the two layers of the dura, okay? And also connected with the pituitary gland. Uniquely, it has arteries, veins, even though it's venous sinus, we call them, but arteries and nerves and veins go through. If you look at it, embryological development of cavernous sinus is different from the other venous sinuses. Okay? These works are Professor Okudera from Japan, his group. He injected dural sinuses in embryo and illustrated beautifully how sinuses are developed. Okay? This sinus, cavernous sinus, this is more of transverse sinuses. Okay? About 17 weeks, okay? Rapidly growing brains, venous outflow has been compromised. Accepted. So there's a ballooning of a development of transverse sinus, okay? And occipital sinus is developing to drain all this venous outflow from the brains. About the 50th week, if you look at the cavernous sinus, there's different structures. Cavernous sinus, you can see the sphenoid bone, body of sphenoid bone is here, pituitary gland is here, trigeminal ganglion, okay? There is quite primitive internal carotid artery is seen here, and there are some sinusoidal venous spaces. Vascular spaces is the venous spaces is there, in about a 15 week. And now you see this fourth nerve, and the sympathetic nerve is here as well. Okay? About 23 weeks, okay, there's a more better development of occipital sinus as posterior fossa, and there is a ballooned transverse sinus is slowed down, regresses a little bit. Okay? In about 23 weeks, bone of the sphenoid is more organized, well developed, and you can see this periosteal layer of the dura, and internal carotid artery is more organized. As you can see, there are sinusoidal venous spaces which is become larger and eventually fuses together and making venous sinuses. Okay? So, venous sinus of the cavernous sinus is venous spaces of cavernous sinus is more of a fusion of small sinusoidal spaces and making later big venous spaces. Okay? We talk about embryonic vessels in cavernous sinus, which many of vessels need to go through. We see the trigeminal, primitive maxillary, dorsal ophthalmic, and other ophthalmic branches we talk about. Okay? We look at it. Embryonic vessels which go through the cavernous sinus is a primitive maxillary, trigeminal, dorsal ophthalmic branch, and hyostapidial system, which we demonstrated earlier. Mandibular branch is a little bit proximal to the cavernous sinus. If you look at it more of reviewing what we discussed before, primitive maxillary artery is early embryonic stage. Okay, it shows early fourth week and regresses very rapidly. It may originate with the trigeminal artery, but it is regress, and posterior hypophyseal artery is medial clival arteries are remaining branches of primitive maxillary arteries. Okay? I showed this picture. The early stage, you have this primitive maxillary artery, eventually regresses very rapidly and disappears, except the remaining posterior hypophyseal artery branch, and also some medial clival branch is remnant of the primitive maxillary artery. This is medial clival branch. You can see Unlike a lateral clival, which is branch of the jugular branch of ascending pharyngeal artery, this is hypoglossal branch of the ascending pharyngeal artery, which is anastomosis with the internal carotid artery eventually. This is medial clival arteries, remnant of primitive maxillary arteries. I demonstrated, I showed you this before. Primitive maxillary artery, if it's persistent in adult life, it goes through the cella. Okay? It has to go through the cella. That's a primitive maxillary artery. This is another example. This patient who had a bilateral agenesis, you can see the cavernous segment is reconstituted through the foramen ovale, inferolateral trunk. Okay? Not foramen ovale, foramen rotundum, I'm sorry. Okay? Foramen rotundum, reconstituting inferolateral trunk and internal carotid artery. Additional supply is coming from this branch, going through the cella. This is remnant of primitive maxillary artery. Trigeminal artery develops as a primary connection from carotid artery to ventral longitudinal neural axis. We said it's a pair of longitudinal ventral neural arterial axis is major supply to the lumbocephalon. Eventually fuses together, making basilar artery and anterior spinal artery. It regresses about 6 weeks. Okay? And remnant of trigeminal artery is usually lateral clival artery. And supply to this carotid and ganglion supply. Okay? Recurrent artery of foramen lasso is trigeminal artery remnant. This is trigeminal artery. You can see from aortic system, ventral longitudinal arterial axis, major supply is trigeminal artery. Okay? This is internal carotid artery, rostrum, or caudal division of the internal carotid artery. Once effusion between the caudal division of the internal carotid artery to developing basilar artery happens, this regresses very rapidly, disappears. The remaining branches are lateral clival artery and other cascadia and basal ganglia supplies. Typically, enteral persistent trigeminal artery. You may see this just before it enters Cavenous Sinus. Large branch connecting to a basilar artery between the superior cerebral artery and ICA origins in between. That's a typical connecting point. This is injection, internal carotid artery filling basilar artery connection, injection filling the internal carotid artery, as you can see in this way. Okay? This is a specimen which is showing trigeminal artery, and this is actually internal carotid artery injection, and a vertebral artery injection shows persistent trigeminal artery. Okay? Depending upon this, how embryologically regresses, some of the trigeminal artery is very large, and basilar artery is relatively small. Okay? And this is a small trigeminal artery with a large basilar artery, as you can see in this case. Some of the cases may have very tiny little trigeminal artery remnant. Okay? And you can see this location of the origin is and actually as a true primitive maxillary artery origin. Okay? If trigeminal arteries are large, some may show agenesis of the mid-basilar. Mid-basilar artery is regressed completely, but rest of the distal branches are supplied from trigeminal artery and some proximal from the vertebral artery itself. Some of these trigeminal arteries supply ICA. This trigeminal artery is going to supply ICA territory. Some supply ICA-PICA territory as well. Okay, ICA-PICA territory supply. This is ICA territory supply, only small portion of ICA territory. Trigeminal artery can go to superior cerebral artery territory. You can see the basilar artery injection shows no trigeminal on the right, the superior cerebral artery on the left side, on the right side, I'm sorry. The trigeminal artery is giving superior cerebral artery directly from the internal carotid artery. Okay. This case part of superior cerebellar artery is supplied by this trigeminal artery. Okay? Part of it. Okay? And this is right side. Okay? Another case. Right internal carotid artery, left internal carotid artery injection shows superior cerebellar artery portion is supplied through the trigeminal artery. Okay? This is a trigeminal artery connecting directly to superior cerebellar artery. You can see the branch going directly connecting to superior cerebellar artery, and this way you can see the superior cerebellar artery, the CTA. Okay? Because trigeminal artery or the primitive maxillary, those are embryonic vessels. It's immature vessels, and you may have tendency of developing aneurysms or other vasculopathy. Okay? This is case, you can see the aneurysm develop from proximal part of the trigeminal artery. Another case, trigeminal artery going to actually icon territory, and you have a small aneurysm developed at the origin of the trigeminal artery. Okay? You probably often see it may have a rupture and causing carotid cavernous fistula because of rupture of aneurysm at the trigeminal artery origin. You can see filling of cavernous, the venous system through the vertebral artery injection, internal carotid artery injection. It indicates probably aneurysm of trigeminal artery origin rupture, causing carotid cavernous fistula. This we treated the coils, and you can see trigeminal artery is filling vascularly through this. Okay? This is clearly showing the aneurysm ruptures. The other, this is trigeminal artery, and primitive maxillary artery is remaining as clival arteries. There's a medial and lateral clival arteries. This is a branch of a trigeminal artery, the branch remnant of the primitive maxillary artery, which is making anastomosis at the clival, along the clivus. And this is one of those case, anastomosis between the right and left. You can see the left side, the dural live fistula was filling through the clival branches behind this posterior clival process. Okay? And you can see this freaky illustrates, and this is the internal right side and left side injection posteriorly. Looking at this, you can see the branches going crossing behind the clivus and reaching Cavenous Sinus on opposite side through the anastomosis. The other branches are, this is, you can see this ascending pharyngeal artery injection. This is old case, but you can see this clival branch reaching the Cavenous Sinus internal carotid artery through this anastomosis. This is anastomosis occurring through this C5 segment of the internal carotid artery. It just illustrates anastomosis between the right and left side of clival branches. Medial and lateral clival branch. Lateral clival branch is anastomotic with the jugular branch of ascending pharyngeal artery. Medial is hypoglossal branch of the ascending pharyngeal artery anastomosis. And also, from right and left side, they make it arcade like this, specific anastomotic channels around the clivus. Okay. The other one, dorsal ophthalmic, we extensively discussed. Cavenous sinus, origin of ophthalmic artery, which goes through the superior orbital fissure and reaching the orbit through the superior orbital fissure. Okay? This is another case of the double ophthalmic artery. You can see the ventral ophthalmic. There's another ventral ophthalmic and dorsal ophthalmic artery that's going through to the supply. This is you saw already. Okay? They may have a small, tiny, little dorsal ophthalmic artery which is going through the superior orbital fissure and reaching the inside of it like this. And remnant of the dorsal ophthalmic artery is inferolateral trunk. We'll talk about more details Tuesday about this. Okay? The other branches are inferolateral trunk, anastomosis from this three branches. One is middle meningeal, accessory meningeal, artery from rotundum. Those ones are possible connection to this cavernous segment of the internal carotid artery from the internal maxillary artery branches. Okay, chicken likewise, three branches of this infralateral trunk. Okay? This is another example of internal choroidal agenesis reconstituted through the artery foramen rotundum and infralateral trunk and cavernous sinus filling. Okay? The other branches from the cavernous sinus is this basal tentorial artery. You can see infralateral trunk giving off small dural branches. Dural branch going laterally. This is basal tentorial, which follows a ridge of the petrous ridge along this superior petrosal sinus, and you can see this reaching a dural labium on the sigmoid sinus on the laterally at this specific case. You see the dural basal tentorial branch originating from that. This is again, this is from the case of the Asan tool. Okay, you can see the infralateral trunk, okay, giving off this large tentorial branch, filling this AV shunt at the petrous ridge along the superior petrosal sinus, and which is draining in petrosal vein and lateral mesencephalic posterior mesencephalic vein is filling this way. 3D illustrated, this is branch coming from, actually, okay, dorsal ophthalmic artery remnant is giving off this branch. One other last thing I'd like to show you is tentorial branches. Free margin of tentorial, okay, which is called the Quadrispone Casanari artery, okay, which initially described the C5 segment of the internal choroidal artery origin. This is typically coming from posterior part, posterior loop of the internal choroidal artery at the cavernous segment, giving off and medially reaching like this. Okay, this is the way, and C5 origin. This is the origin of the branch giving tentorial. Okay? However, this medial tentorial artery of free margin of tentorial can originate from ophthalmic or infralateral trunk, or this is C5 segment. The different origins in there. Okay? This is, you can see the typical origin of the C5 segment, bilateral, okay, medial tentorial artery and reaching there. This case is off from ophthalmic artery. You can see the ophthalmic artery giving off this branch. This is intra-orbital branch, which comes from the middle meningeal artery, and this is branch coming off from the orbit and going through the superior fissure. This is Philip gave me this slide, which is showing you this is coming from ophthalmic artery reaching out. This is another example. You can see this is ophthalmic artery giving off this medial tentorial artery going along the anterior interclinoidal process and going medial margin of tentorium. This is branch. Okay. You can see this is coming from ophthalmic artery. The other branch, basal tentorial, is coming from the C5 segment of the internal choroidal artery at this side. Okay. Some of this ophthalmic, the medial tentorial artery is just giving off the middle meningeal artery. You can see the middle meningeal artery, okay, giving a lacrimal branch, and this is going into interclinoid process. Okay. And this is branch going along the margin of tentorium. Okay. This is another example, middle meningeal origin of medial tentorial artery. You can see the middle meningeal artery giving off this branch. This is going along the free margin of tentorium and filling this dural AV shunt and tentorium. Okay. Lastly, this branch is originating from accessory meningeal artery. Accessory meningeal artery is giving off this medial tentorial artery and reaching AV shunt and incisura of the tentorium. Okay? So there are many possible branches coming from the cavernous sinus to reach dural in this region. So this is a branch, selective injection in the cavernous sinus. In the cavernous sinus, I injected before I put in the coils to close this dural AV shunt. But look at how many branches are filling. Okay, this is ophthalmic artery is filling this way, And there is a branch coming from artery from rotundum and internal maxillary artery territory. I think this is a branch of the I think internal carotid artery branch. But remember, there are so many branches. Anastomosis can occur in cavernous sinus as well. Any questions? Short review of this.
Thank you very much, Dr. Walker. I just wanted to know how difficult it is to distinguish between